Have you ever paused to consider the unsung heroes in healthcare, the caregivers who work tirelessly behind the scenes? In this episode, we delve into Cindy Sim's journey with Team Carepal, shining a light on their commitment to bringing support and connectivity to caregivers, demonstrating the power of heartfelt innovation in making a real difference in the lives of those who dedicate themselves to caring for others.
Welcome to Healthtech Growth, the weekly podcast for healthcare founders and innovators, where we explore essential strategies to create successful and sustainable healthcare startups that improve patient outcomes and transform the healthcare industry.
Hello, I'm Dr. Aaron P. Bryant, co-founder and COO at Pulse Point Path. I have provided 30 plus years in healthcare and technology with leadership roles within the public sector, Intel, Affordable Care Act, and Kaiser Permanente. But today we touch on Cindy Sim. This passionate CEO and founder of Team Carepal has applied her heart and soul towards revolutionizing the efforts of an underrated and underappreciated area of caregiving. Leveraging technical innovations through her company, Team Carepal, we will explore the future of caregiving support from Cindy's visionary efforts and insights.
Caregivers are the millions of Canadians across Canada. There's over 8 million of them. And I know in USA, they're the equivalency per capita. And they are the unrecognized, unpaid, and generally unsupported group, the largest group of healthcare providers in Canada. They are hitting burnout, and they are the backbone that holds our healthcare system together. So Team Carepal is a mobile application and software solution that supports caregivers during their caregiving journey of caring for their loved one. All in one place. We have a mobile application and a software solution for organizations to connect to caregivers. And it was created based on my experiences from a caregiver, and it's co-designed by caregivers after surveying the market and diving into the research. And, it's a collaborative approach from universities across Canada. And this is what we've come up with to help solve that pain point. We originally started with a mobile application that we launched in June. So it's our, business to consumer. So we sell it on the app stores to caregivers. Our biggest challenge there is that caregivers don't recognize themselves as caregivers. So they're not really looking for us. And so we've really had to pivot in a lot of ways to identify what caregivers are searching for, and kind of get in front of them that way, as far as like dementia support, those types of things. And, caregivers don't have a lot of time and they're hitting burnout. And, so it's quite hard to kind of get in front of them. So, and that's pretty normal for B2C. B2C is quite hard to scale. It wasn't until we started, really collaborating with our major stakeholders across Canada and North America to determine that there's a lot of organizations out there that really wanted to support family caregivers, not just by sharing Team Carepal, but by, connecting to them. Canada, our public system, because it's, paid for by government, and even our beautiful non-for-profit organizations are also, paid for by government. And so they're kind of mandated to really support, by sharing resources and solutions that are free and paid for by government. So there's a lot of incredible solutions left on the table, such as Team Carepal, that they can share. So we've kind of started like a black market up here of people sharing us, like firemen. I was talking to firemen, and they were like, we go into houses all the time, and these caregivers, and oh my goodness, and they just want to share us. And I'm like, well, you can't, because we're for profit. Like, you literally can't. And they know this, and they're like, well, we don't care. We're going to share you anyway. So I have and the collaboration is quite halted at that stage too. We have so many incredible people that want to do things, but they just can't. And so, that was really hard for us, especially being a social enterprise. We have a mission that, nobody should care alone. And so our model is really a pay what you can with a sliding scale. And we even sponsor, caregivers that can't afford us. And so we've tried to do the best that we can, making it really easy to collaborate with. But just the fact that we are for profit on paper, just like it's a hard no. And so we really had to pivot, look at other for-profit organizations on the table. And, with the dire situation of our healthcare system right now, resources being really thin and them not being able to meet the demands of what's happening, there is a lot of for-profit solutions that are coming out of the woodworks. So we started, partnering with like nurse practitioners, virtual nurse practitioners, and just incredible solutions. And it's a really big pain point because in Canada, the public system isn't sharing solutions. And I really believe that Canadians should have their choice of care that's, out there, whether it be, a therapist, a counselor, and family mediator. Like there's just so many incredible things out there that can solve a family's problem, but they don't even know it exists.
During our interview with Cindy, we were in awe of her passion and commitment to this working arena. But unfortunately, passion alone does not pay the bills. So we asked her about her current challenges she is encountering while trying to achieve consistent revenue growth. Right off the bat, I could tell that she was someone that understood what it takes to adapt and overcome. Immediately, Cindy responded to how Team Carepal has pivoted a lot in their journey. So clearly, her team was not going to remain stagnant. You see, flexibility, or as Cindy likes to say, pivoting, will help businesses respond to market changes, team workload, and accuracy relating to projects. Another term, agile, will allow one to adjust without making drastic changes to the operations. This is why many companies are leveraging the use of sprint sessions on a daily or weekly basis. And although many may feel it is another meeting to attend, the amount of work it can prevent from being corrected will save much more time and money. In project management, system or software development lifecycle, SDLC, provides specific areas to evaluate before moving to the next phase. Again, providing an opportunity to save time and money. So I applaud Cindy for recognizing this, especially since she identified the growth of future elders and a growing demand for caregivers. We also asked Cindy about barriers of communication with key stakeholders. It is unfortunate that she is in a unique situation. Her words, that the country she is in restricts her as a for-profit business and limits her ability to gain access to stakeholders. However, as I personally was considering the number one success of networking, which is word of mouth, I hear how Team Carepal has provided a pricing sliding scale for their services. This is applied to the clients, which will, in my opinion, get anyone to start talking about this company. Can you imagine if a person is on a limited income and Team Carepal is willing to factor that into their price point? Who will not discuss this amazing company? In addition, Team Carepal is collaborating with the audience of caregivers who have direct access to the stakeholders. This is what you call leveraging the playing field to your advantage. Now, it really caught my tech radar when Cindy discussed how Team Carepal had to change their marketing strategy. They did this by adjusting their marketing and messaging system within the application store. Because apparently the term caregivers was not getting access or getting across to those whom operated in those particular roles. Go figure. When using virtual resources, terminology plays a role that is more than critical. The wrong use of wording could direct you into an area that is slightly off base from an intended goal or audience in this particular case. This is why context and specialized terms are so important. Lingo, titles, and current roles, well, these, in any industry will require a necessary awareness and adherence when communicating. If you're leveraging resources specifically, such as search engine optimization, SEO. In addition, Cindy discussed how she had to pivot by leveraging Google Ads versus Facebook because the demand for resources by the caregivers are going to Google for assistance. So no surprise there. If you want to build your brand awareness and connect with customers, Facebook ads is a great option. However, if you want sales and resources, Google should be your initial choice. Clearly, the switch worked for Team Carepal.
Thank you for listening to Healthtech Growth. If you're a healthcare tech innovator or founder interested in being a featured guest on our show, visit healthtechgrowth.io to learn more.